If you've been told you need aortic valve replacement surgery, then you have the eternal dilemma. Do you choose a mechanical or a carbon valve, which will last forever, but of course will need a blood thinner called Warfarin, which is a tablet you take daily, you need regular blood tests, you will bleed more if you cut yourself. The alternative, of course, is a tissue valve made out of pigs or cow's tissue. These are valves that will just not last forever, and if you're a younger patient, they're probably not the best way forward. Modern day tissue valves have changed a great deal. You'll have heard perhaps about the Inspiris Resilia valve made by Edwards Lifesciences, and today I'm going to talk to you about the Medtronic Avalus pericardial valve. So is the Avalis pericardial tissue valve the Holy Grail? Is this valve going to last forever? Is this the valve for younger patients? If you want to know more about the questions I've just raised, then this video is for you. And if you want to know more about the Inspiris Resilia valve, that video is linked at the end of this video, so you can enjoy that one too. Let's get started. The Avalis tissue valve is what we call a stented tissue valve. That means that it is a stent made by a human, and in this particular case, it's a non-metallic stent covered by a cloth. That cloth is to protect the stent and the blood from the stent itself. It also has a little sewing ring here that allows a surgeon to sew the valve into place. Inside the valve is a hole, and this hole is guarded by 3 leaflets made out of a cow's pericardium. 1 leaflet, 2 leaflet, 3 leaflet. Now, the secret of the Avalis valve lies really strictly in the way that this pericardial tissue has been treated. It's been treated by some process that allows it to prevent itself from becoming calcified over time. We call this AOA treatment, Amino Oleic Acid treatment. By treating the tissue in this way, the valve is unlikely to calcify as early as it would do if we didn't treat it this way. And early data from the PERIGON trial, which has looked at over 500 of the Avalis valves in human beings, has demonstrated that at 5 years, there's no evidence whatsoever of something called structural valve deterioration. The reason why the valve itself will fail. There are other reasons why a valve can fail. A valve can become infected, or it can clot off, or it can tear from the inside of the aorta, perhaps as a result of infection or inappropriate suturing. But of course, structural valve deterioration is looking specifically at whether the valve itself has maintained its integrity. So for it to have 100% absence of structural valve deterioration at 5 years is very impressive. Now, the real problem we have is, what is this valve going to do at 10 years, 15 years, and 20 years? Well, the evidence in vitro is indicating to us, and that is evidence that we get from studies that are not done in humans, that is telling us that this tissue treatment is likely to last into the long term. So we're seeing a valve that has very similar potential long-term durability as that we might see with another valve called the Inspiris Resilia valve, which you can watch more information about in another video that's tagged on the end of this particular video. What I particularly like about the Medtronic Avalus valve is its hemodynamic function. Now, what do I mean by that? Now, let's go back to the actual stent. The stent has a hole in it, guarded by these 3 leaflets. The bigger that hole in the middle, the less obstruction to blood flow that we will see. And the less obstruction to blood flow that we see, the better the hemodynamics of the valve. Now, early data is indicating that the hemodynamics of the Inspiris Resilia valve, when compared to the hemodynamics of the Avalis valve, are such that the Avalis is slightly superior. Now, whether that's going to confer added clinical benefit to the patient is difficult to know. Only time will tell. I suspect that the difference is so marginal as to be relatively insignificant. So whether or not you are a proponent of the Inspiris Resilia valve or the Medtronic Avalus valve probably makes no great difference at this stage. What we're more interested in knowing over the course of time as surgeons is what these valves are going to do at 10, 15 and 20 years. So if we go back to the early question, is the Avalis Medtronic pericardial tissue valve, the holy grail of tissue valves. Is it going to last forever? The answer is we simply just do not know. But it's very likely that this valve is going to be extraordinarily durable, and in younger patients, I'm certainly an advocate of using it in that setting. Generally, on the whole then, if we talk about valve choice, under the age of 50, it's probably better for you to have a mechanical valve. And the data is beginning to tell us that the Onyx carbon valve may be a very good choice, because after 3 months you can run the blood thinner much, much lower in addition to aspirin. And there's some lovely data that's been published recently that indicates that that reduces the risk of bleeding complications associated with warfarin without actually conferring any disadvantage to the lower blood thinning, the Onyx carbon valve. Over the age of 70, there's no doubt tissue valves are the best way forward. And whether you have a traditional tissue valve, the Inspiris Resilia valve, or the Medtronic Avalus valve, probably is not going to make a great deal of difference. Between 50 and 70, you've got a lifestyle choice. And there's no life-enhancing benefit of choosing mechanical or carbon over tissue valves. But I think if you do choose a tissue valve in that age group, then it might be more sensible for you to go with the Avalis valve or the Inspiris Resilia valve in the hope that these valves will be more durable. Now, one thing that's changed the game with tissue valves is the use of Tavi. This is a way of putting a valve from the groin without surgery into the aortic valve and into a failing tissue valve. So you can imagine, here we have the Avalis valve. Imagine the leaflets get diseased over time. We can actually place a Tavi valve through the groin into that diseased leaflet, sit it into the stent, let the valve open up, and that will be an immediate fix. We're already doing that now. So in 15, 20 years' time, that technology is going to be even further advanced. So it's very, very likely that even if you choose a tissue valve and it does wear and tear over time, there will be a very simple solution for you that doesn't mean surgery. One other great benefit of surgery today is that in experienced hands, we're able to do this operation to replace your aortic valve with one of these valves, or in fact, any of the valves I've described, through a small cut between the ribs on the right-hand side. Now, the beauty of this is this cut heals in 7 or 8 days. You'll be back to normal activities extremely quickly. And because it preserves the breastbone, younger patients are choosing a tissue valve through here, recognizing the use of Tavi as that technology improves over time as a potential solution, but also recognizing that if they need repeat surgery, then the breastbone has never been opened. And we can do repeat surgery very easily by just doing a small cut into the bone later in life if surgery is the only solution. Surgery with a tissue valve through here is particularly useful in young women who've got aortic valve disease, who have not started their family, and they want to avoid blood thinner, but they also want all the options for repeat treatment, whether it be surgery or whether it be Tavi down the line if that tissue valve were to fail. So lots of options there for you. If you want to know more about other valve types, there's lots of videos on the YouTube page here. The video tagged at the end of this is Inspiris Resilia. We'll be publishing the Onyx carbon mechanical valve video very, very soon, so look out for that. Like and subscribe the page and you'll get notified when that video is released.